Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. I'm here today with Teresa Mahon, who has an interesting product that I think a lot of my patients could use. And let's just go ahead and get started. Can you tell me a little bit about yourself, Dr. Mann?
Yes, I sure can. Number one, thank you for having me. It's a pleasure. And I am a board certified OBGYN. I'm in practice, so just about 24 years. I have been in private practice for many, many years. And in the past few years, I'm now an OB hospitalist, OBGYN hospitalist, and I work out of Connecticut.
What made you switch to being a hospitalist?
You know, it's interesting. The demands of private practice really, it became too much. And I felt like I really could not give my patients the attention I wanted to give them.
Yeah.
And it became sort of more about quotas than quality time with patients. And I just felt like I really could not do them justice.
Yeah, it's an interesting time in medicine, isn't it? And I think that's what drives so many physicians to make changes, right? Because we just don't feel like
Yes,
giving the level of care that we really want to give.
absolutely. Hmm.
And, hospitalist, which is, when you only work in the hospital, right,
Right.
versus seeing patients in the clinic, just works a lot better for a lot of people.
It does. And you know what? You can give a little bit more attention. As you said, it's just inpatient care or hospital care, but you have more time actually to give people, which I know sounds crazy, but so
Yeah.
it's a big plus for me.
Yeah, I applaud you for making that change, right? And figuring it out because it is, it's hard to figure out what makes you happy at work some days. So tell me a little bit about the product that you have.
Okay, so I created a panty, and actually it happened because for years I would see my mother's postpartum, and they would be anyone who's had a baby knows the vagina gets swollen, the labia gets swollen, you can have tears, cuts, stitches, and they're basically sitting there postpartum in bed with their beaten up, swollen vaginas, sitting in a diaper with ice in the glove, in the folds, or a glove with ice between the legs. And for years, I would see these women, I'd say they work so hard in labor. This is so, quite frankly, disgusting and undignified. And they're stuck in bed. That's the last thing they need to be, is stuck in bed for number one, for their own health, but they're taking care of a newborn.
Right.
And I would leave the room thinking someone has to do something about this. And, of course, knock on wood, right? Several years later, I finally realized I should do something about it. I know what they need, and I'm going to do something about this. So that's how PIPS got started. Basically, it's a boy short panty with a pouch in the crotch that is anatomically correct. And I'll explain that in a minute. But the pouch holds an ice pack and a sanitary napkin because you do have bleeding after birth. But the problem was, and I'd also seen my mother's with a sanitary napkin and the ice pack behind it, which was basically useless. So I said, you know what? I have to create something where the ice pack can be near them, the vagina and the perineum, but they can have the sanitary napkin there. So I brought one to show you. Is that okay?
Yeah, that's great.
Okay. So here it is. It is so super adorable, says me. It's a candid opinion for you, right? Okay. Anyway, here it is. This is Pip's panty. Totally cute little boy short. But the beauty of it is in the crotch is this pouch that has an opening in the center. So the ice pack goes in and stays against the vagina and perineum, but the opening there's room in the pouch for a sanitary napkin. So any bleeding or discharge goes right through the opening to the sanitary napkin, and the nice cold ice pack stays against the vagina and perineum. So that is PIPS.
Yeah.
And the ice bag also has a center opening. So that's how the discharge or any bleeding gets to the sanitary napkin.
Yeah. It's such a simple idea that it just amazes me that this hasn't been around for longer.
Honestly, my own opinion as an OBGYN, I don't know that mothers and maternal care gets a lot of attention or as much as it should.
Well,
Just my opinion.
yeah, I think that's a whole nother episode, right? Because I would
Hmm.
definitely agree with you. And it's such a fragile time for so many women, right? Where you're really just getting by, right? You're taking care of your newborn, you're trying to keep it all together, you're healing, you're trying to eat, you're trying to get enough fluids. I mean, everything is just it's just a difficult time. And so coming up with something like this, when you're in that state is pretty difficult. So, kudos to you for
Oh,
creating this.
thank you.
So I was interested in this product. So I think it's great for postpartum women, but I also love this idea for surgical patients. So, I do a lot of vaginal surgeries, and after surgery, we frequently tell our patients to get frozen peas, right? And just kind of sit there with the frozen peas because ice really does help, right? I mean,
Hmm.
the swelling,
Absolutely.
feel a lot more comfortable, but it is incredibly low tech. It's hard to do, and then you really can't move around. So I think this product is just such a simple but great idea, right? And after surgery, you can have a little bit of bleeding too, so you need a pad as well. So it just kind of all fits together.
Yeah. And I actually, when I had started to think about this, I too was thinking, you know what? I could use this for my surgical patients because they have exactly the same problem. The glaring need was postpartum. And that's kind of the thing that really like spurred me on, but absolutely right. Yep.
Well, I think, yes. I mean, I definitely agree with that. I mean, the big difference between postpartum and, I mean, there are a lot of difference between postpartum and surgery, but I think one of the big differences is you have less tissue edema, right? There's a
Mhm.
lot less swelling
Yeah.
happens after surgery as compared to after laboring and pushing. And, there's just a lot more soft tissue trauma that
Yes.
happens. But still, it's a delicate area. It's a hard area to rest and it, can be painful. And, if
Mm.
ice makes it better versus pain medication, well, let's do
That's a win. Yeah.
it, right? I mean, it's
Yeah.
just such a win. So, what have women said? The people that have tried this product, what kind of feedback have you gotten?
Well, honestly, really fabulous. And the first thing I did was I said, you know what? This has been my experience. Let me first take it to industry conferences and show it to peers and colleagues and see what they think. And of course, people went crazy. They were like, oh, why didn't we think of this 50 years ago and all that? So that was so reassuring and wonderful. Now I am getting I'm getting grandmothers buying it for their daughters saying, why wasn't this around when I had my baby? And just really a great response. Um, I had one woman, she actually called me and she said, I have to tell you something. I have eczema on the vulva after I had my baby. I was just in agony. And she said, this helped me so much. I had one mother write me a one-word review. Brilliant. I was so happy. I'm so delighted. I'm so delighted that it's being received well and people see the utility of it.
Yeah. Was it hard to bring it to market? I'm always so interested in those stories.
You know what? It was because first of all, just the manufacturing piece, from the conceptualization in my head to getting a product,
Yeah.
right? So that was a huge thing. Number one, making it anatomically correct, then finding the right fabrics. And I'm lucky I'm near the New York metro area. We have the famous garment district here. So I was running down there trying all kinds of fabrics and then finding a manufacturer. And I really wanted it manufactured in the United States. I had a couple of criteria. I wanted it manufactured in the United States. I needed someone who could do small batches for me, prototypes, as I kind of got the iterations correct. And then I had really wanted it to be a fair wage manufacturer because what I learned in my adventure here is that in these manufacturing garment jobs, these workers are paid by the pieces they sew. And I didn't want that. I really was looking for a fair wage manufacturer, and I found one in Minnesota, Clothier Design Source. fabulous, woman owned and run.
Nice.
And the designer who helped me actually was a new mother. So she was very enthusiastic about the project. So that was sort of how the thing came to be ready for the marketplace. And then, of course, I took it to industry conferences. I'm on social media. And now I'm just starting the outreach to hospitals, and it's very well received, but that's just a new venture. So I don't have a lot to report on that yet.
Yeah. Can you talk about the fabric? Right?
Yes.
One of the things that people ask a lot about incontinence underwear is about the PFAS chemicals,
Mm-hmm.
right? Those forever chemicals.
Mm-hmm. Mm-hmm. So this panty is spandex poly because I needed something to give a little stretch.
Yeah.
And the same with the pouch. It's the same, it's all the same material. And it's totally washable and reusable and only comes in black for obvious
Yeah.
reasons. So, and to be honest, I tried cotton, but it wasn't pliable enough with the pouch and the crotch. So I really needed something that had some give because especially postpartum, you don't want anything digging into the vagina too tight. That's not helpful.
Do you test it for PFAS chemicals at all from the manufacturer?
No, I did not. Mm-mm.
Yeah. Okay. And then you said it's machine washable, so you can just wash it at home. There's no special.
Mm-mm. You can hand wash it, machine wash it, and put it in the dryer, hang it up to dry, and it's ready to go. And even the bags too could be reused. That's the beauty of the whole system. I know we're a throwaway society, which drives me crazy, but everything is reusable.
Yeah.
And that's the piece I really love.
Do you want to talk about why it's anatomically correct?
Yes. Okay. So if you know your vaginal anatomy, there is an opening there where your urethra and vagina are and rectum at the bottom. And so the pouch is got an opening in the center of it. I don't know if you can see that's my fingers there. Okay. So that corresponds with the vaginal opening and the urethra. And so any drainage can come right through that area to the sanitary napkin that sits behind the ice bag. And that's why it's anatomically correct.
Yeah.
And it keeps the ice right against the vagina and the perineum. And by the way, if somebody has hemorrhoids, the pouch extends back that it'll also give you some ice to your hemorrhoids too.
Have you ever thought about creating a male version or marketing it to men as well? I mean, when you said hemorrhoids, that just made me, think about that because there are definitely reasons why a man might want something like this as well.
I have thought about it, but it would really need to be resized and
Right.
configured a little bit differently for men.
Yeah.
But definitely, yes, and marketed in a different way as well. And so that's a whole nother adventure. But yes, absolutely. Because cold therapy, it's universal.
Yeah.
Everybody can use it.
Yeah. I think postpartum definitely is the highest need. And you're right. It gets underserved, but it seems like there are so many other places where this would be helpful. So tell me again where you can find this product.
First, let me tell you what you're getting when you get the product. So you get a package with the panty, one panty and 2 ice bags. And I am on Amazon, have a love-hate relationship with Amazon. I have to be upfront about that. They're not so nice to small business, but I am on Amazon. It's $34.95. If you buy it on Amazon, you have to pay for shipping, unfortunately, which is about $5. I also have a website set up, PIPS, P-I-P-S, pipscomfortcare.com. You can buy it on the website for $34.95. I do not charge for shipping and handling if you buy it off the website. I'll ship it anywhere in the continental United States. So those are the 2 places you can get it. And the cost is $34.95. Amazon, you pay for shipping. On my website, Pips Comfort Care, no shipping charges.
Okay. Do you ever have sales or discounts?
Occasionally I do. Occasionally I do have those, and I will put out a blast on my social media if I'm going to do that so people will know. But not running any sale at the moment. But yes, I do. The answer is yes.
Do you do it at certain times of the year? Like, do you do it on
Yeah.
Mother's Day?
Yeah, around Mother's Day and kind of high high volume birth months. Sometimes I will do something before that. Like November's a pretty big birth month.
Yeah.
So sometimes I will do it before then.
I think a lot of people don't think about that, right? How there are trendy times to get pregnant,
Yes.
you know, during snowstorms and, all of those things. It's funny how
Yeah.
that happens. Everybody has the same idea at the same time. Okay. Well, thank you so much. Congratulations to you for
Thank you.
creating this. I think that you're serving, such a huge need. I'm happy to, help you get the word out there and, good luck to you. What's your
Thank you. That's so
next idea?
fabulous. Sorry, say again.
What's your next idea?
Oh, well, I really want to get this underway before I start with the next one because it's an awful lot of work.
It's interesting, right? Because it seems like it should sell itself, right? And
Mhm.
once people heard about it, they would really want to start using it. But I know that it is never quite as easy as it seems.
Oh, absolutely not. Absolutely not. It's been a real experience for me because, I'm an OBGYN. I'm not a business person, but it's been a real learning curve.
Yeah.
Business is a real different animal and it's really something. And, I had to learn the language of business because that's not my training, obviously.
But it seems like
But
you've enjoyed it, right? I mean,
I have, I have so enjoyed it. And it's always good to learn something new.
yeah, in some ways, I think it's rejuvenating, right? I mean, if you had said to me, a year ago, oh, you're going to be doing this podcast, I would have said, absolutely not. I don't know how to do that. I don't understand the tech, right? There are so many, barriers and hurdles. And then, once you start kind of trying things, I mean, I think that whole learning experience and doing something new is, super fun.
Yes, it sure is. It really, and you know what? I've met some wonderful people along the way.
Yeah.
And they've become friends now and they
Yeah.
taught me a lot about their area of expertise. So how great is that?
Yeah.
And women owned business, which I just love. That makes me so
No, I totally agree with that. And it's amazing how generous people are with their time. I think,
they
yeah,
they
just,
are.
yeah. I mean, I've had the same experience, right? And have developed kind of this online community, with just a lot of people who are super supportive,
Mhm.
you know, which has been fun as well. Because I think you get to a point in your job. I mean, I really like what I do, but there's a point where it becomes a little routine, right? And you're looking to,
Yeah,
expand,
absolutely.
grow, try new things.
Absolutely. Yeah, keep it fresh and keep growing professionally too. And by the way, your content is great. Actually, I've seen your things on Instagram. They're really great.
Oh, thanks. It's, I mean, I think a lot of it is like, probably the first trade conference you went to, right? Where you have these ideas, but you don't always know how they're seen on the other side, right? So thank you very much for that feedback.
Exactly. 100%.
Yeah. All right. Well, I'm going to let you go. Enjoy the rest of your day, and thank you so much.
Thank you so much too. It's been a pleasure. Bye-bye.
Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.